You're told by your doctor that everything's normal, but you still have symptoms. Let me paint a familiar picture. You book an appointment because something doesn't feel right. You've been tired for months, or in pain, or dizzy, or just not yourself. Your doctor listens, they examine you, and they order some tests. Maybe some blood tests, maybe a scan. You wait, maybe you Google a little, and then you come back for the results, expecting answers. Maybe you even know or think you know what it might be. But then the doctor says, everything's normal. Maybe they even say that with a smile on their face. But in that moment, you're thinking, I don't feel normal. Hi, my name's Dr. Amayo. I'm a GP based in the UK, and I want to talk you through what a normal result actually means and what to do if you still don't feel right. First, let's clear up the biggest misunderstanding. When a doctor says everything is normal, it does not mean that you've imagined your symptoms or that you're being dramatic or that it's all in your head and nothing's wrong. What it usually means is that based on the tests that we've done, we haven't found a clear cause and we're reassured that we've ruled out the more sort of serious or dangerous possibilities, which is actually a very important first step. For example, if someone comes in with chest pain and all their heart tests are normal, that doesn't mean that the pain isn't real. It just means that we're reassured it's not a heart attack, and that changes what we do next. But here's the problem. Reassurance about what it isn't doesn't always help when you still don't know where it is. The problem is, investigations have limits. They don't always show everything. Some conditions don't have a single test that confirms them. They rely much more on a careful history and examination. Things like IBS, migraines, or chronic pain syndromes. I see this a lot in practice. Someone comes in with ongoing tummy pain, but their blood tests are normal, their scans are normal, but the pain is still affecting their daily life. Like I said, this doesn't mean that nothing is going on. It just means that the tests don't always have the answers. Another common situation is when something is going on, but it's subtle. Take hormones, for example. Your blood results might sit neatly within the normal range, but that doesn't mean your body's happy. Small shifts can still cause symptoms, especially when combined with other factors like poor sleep, stress, or illness. But this won't show up in a blood test. The fact is, there is no blood test for things like sleep deprivation or stress, but they can have a huge impact, especially when your reserves are low. And sometimes, if we test very early, the problem hasn't developed enough to show up on a test. Often in medicine, time itself is what we need before the picture becomes clearer. So what should you do when the tests are normal but symptoms continue? I usually break this down into 4 steps. Step 1. Understand what's been ruled out. This step is about clarity. So you need to ask your doctor, what were you most concerned about? What has this test ruled out? Knowing what isn't happening can be just as important as knowing what is. And it's important to make sure the serious concerns have been ruled out before moving on to the next steps. Step 2. Trial, observe, adjust. Medicine often involves a bit of trial and error. You might try a symptom-based treatment that your doctor might recommend. Maybe you try some lifestyle changes. Maybe you try a short course of medication. The key question to ask is, what are we expecting to change if this works? This gives you something concrete to measure. And trial and error is also part of information gathering. Seeing how symptoms respond can sometimes tell us more about the cause than tests alone. Step 3, think about specialist input. Now be clear, not everyone needs to see a specialist, but if symptoms are persisting, worsening, or significantly affecting quality of life, then a referral may be appropriate. Your doctor's role is really to help judge when that next step makes sense. Step 4, don't disappear. This is the step people often skip. If symptoms continue, or just as importantly, if they change, it's worth going back with a clear update. Explain to your doctor what's changed, what hasn't, and what's worrying you the most now. And sometimes, over time, you may reach a point where we've done all the tests, we've involved all the specialists, and we've tried the available treatments. That doesn't mean nothing can be done. It may mean that the focus shifts from finding a cause to finding the best way to live well with the symptoms and reducing how much they affect your day-to-day life. And it's worth holding on to hope. Just because medicine hasn't figured it out yet doesn't mean it won't. Advances happen every day, and sometimes we simply need more time. There are conditions that I was taught about in medical school where we had no real answers about how to treat, and now we do. Take hepatitis C, we now have a cure, or HIV, where people can live long, normal lives with treatment. So if you're still looking for answers, you're not alone, and your symptoms still matter. Medicine keeps moving forward, and what doesn't have answers today may have them tomorrow. And sometimes finding answers means trying different things and just seeing how your body responds. And over time, that response helps the picture become clearer. So, here's a key thing to remember. Normal results don't make symptoms imaginary. They give us reassurance and room to take the next steps thoughtfully. If this is something you're navigating, you're not alone, and coming back for review is often exactly the right thing to do. I hope this has been helpful. This has been Medicine Made Clear with Dr. Amayo.